Welcome to the Patient Advocacy Show. I'm Dr. Michael Warner. In this episode, I will show you how to cultivate the status of a chronic condition as part of a prehistory. From our last episode, you learned about the prehistory. It's a 3-page form of about 30 questions that is a replica of the official history as recognized by the Centers for Medicare and Medicaid Services, CMS. This is the list of questions that a doctor is trained to ask when conducting an interview of a patient during a medical encounter. This is the potential list of all the questions because it is difficult for a doctor to ask each question, allow for the patient to respond to each, and then type or dictate the answer into the computer. There is just not enough time to do this during a typical medical visit. Our research paper, published February 1st, 2017 in the Journal of the American Osteopathic Association, JAOA, describes the clinical research project in which I was the lead investigator, where we allowed the patient to complete all the questions in preparation for the visit. At the visit, before I saw the patient's answers were entered into the appropriate fields in the history component of the patient's electronic health record. I was able to enter the room, greet the patient, and then read what the patient had written in less than a minute. My understanding was as if we had been talking for 15 minutes. Excellent, efficient communication of health information. The prehistory, as a replica of the history, is composed of the chief complaint, the history of present illness, the status of chronic disease, review of systems, and past family social history. As you recall from our last episode, the chief complaint is a short description of why you came to seek medical care. The review of systems is a head-to-toe, mind-body inventory, and the past family social history includes your medication and allergy list, as well as prior surgeries and illnesses, and changes in lifestyle and family health history. The history of present illness is used to describe a new problem, while the status of chronic condition is used to describe chronic conditions or diseases. In the last episode, we reviewed the details describing the HPI. Remember, location, quality, severity, duration, timing, context, modifying factors, associated signs and symptoms. This is how you describe a new problem. For an old problem, or a problem that was already addressed once as being new, then the status of chronic condition is used. For billing and coding purposes, it is worth knowing that the status of chronic condition as of September 2013, was accepted by CMS as part of both 1995 and 1997 documentation guidelines. Unlike the HPI, which has detailed components, the status asks for an update regarding the condition or conditions. In the last episode, we addressed diabetes, high blood pressure, and high cholesterol. For this episode, let's discuss how a patient can narrate a status for 4 different scenarios. A little deeper with diabetes mellitus, trouble swallowing, and the visit after a knee injection, and a visit after receiving osteopathic manipulative treatment, OMT. We will address each separately as if they were 4 different patients. A key to remember with cultivating the status is to recount what occurred at the last office visit, LOV. Summarizing what occurred at the last visit gives indication that you understood from the assessment and plan, what was to happen. You can then describe what happened since then. Here's an example for the status of chronic condition for diabetes mellitus. Diabetes mellitus. Last office visit, we increased my evening insulin dose from 20 units to 24 units because my sugars were too high. Since the increased dose, my fasting blood sugars have dropped from about 160 to 140. I ate sugar-free chocolate pudding one night, and my morning sugar was 170. I used milk to make the pudding, and we'll try unsweetened almond milk next time. I checked my feet for sores, and I went to the eye doctor, Dr. Bezic, last week. He says there's no change. I'm able to take a walk nearly every day. Here's an example for status of chronic condition for trouble swallowing. Trouble swallowing. Last office visit, we discussed my trouble swallowing, and you recommended that I get a scope of my stomach with Dr. Abood. I felt sick the day before the test, so I canceled it. Yesterday, I tried to eat a hamburger, and it felt stuck in my throat. I was forced to go to the bathroom and vomit. I am able to swallow fluids without any problem. Here's an example for status of chronic condition for a visit following a a previous visit with a knee injection. Right knee pain, last office visit, you injected steroids into my right knee, which was 2 months ago. You have done this before for me in the past, about 4 times over the past 5 years. Since the shot, as always, it worked great. I felt better as I left the office and really felt good about 4 days later. My knee pain is gone. Though I'm retired, I'm very active. I volunteer twice a week as an usher at church and golf once or twice a week with my buddies. We walk 9 holes. Here's an example for status of chronic condition for a visit after osteopathic manipulative treatment, OMT. Neck pain, LOV, last office visit. I presented with right lower neck pain after falling asleep in the chair watching a late football game on TV. You have given me OMT in the past, and it has always helped. This time, the OMT got rid of most of the pain, and I am able to turn my head better to the left. The pain was 8/10, but now it's 1/10 at rest, and 3/10 when I turn my neck far to the left. I have not missed any work, and I am doing the instructed exercises that you taught me. You told me to take ibuprofen, but I did not take it because I felt better and I wished to avoid medication. Now, some believe that the patient's words are anecdotal, meaning they are not reliable because they are based on personal accounts rather than fact. The history, however, is derived from the SOAP note, SOAP, that was promoted by Dr. Lawrence Weed in the late 1960s. Dr. Weed encouraged doctors to adopt a structured format for documentation, uniformity, and better understanding. The S stood for subjective, meaning the patient's subjective story. The O for objective, such as laboratory reports and examination. The A for assessment, and the P for plan. The assessment and plan are today known as medical decision-making. The aim of this program is to put the patient's narrative back in the history. While the patient's story has been overlooked, new concerns are arising that see the patient's experience as valuable health information. These examples capture the value. Take the patient with diabetes. You can tell a lot about this patient and his management by his story. He recalls the last visit where the insulin dose was increased due to high sugars. He increased the dose and saw his sugar readings lower. To avoid excess sugar, he ate sugar-free pudding and his sugars rose. He seems to have figured out that perhaps the natural sugar in milk made the rise, so he plans to use unsweetened almond milk next time. He checks his feet and recently saw the eye doctor. This is more than an anecdotal tale. The second example of the patient with trouble swallowing is more alarming. He felt sick and canceled the test. When is the next test rescheduled? If it was not rescheduled, then now is a fine time for the medical staff to call and arrange for the test. Prior to finding out what is going on, this patient needs to be advised to eat soft or pureed food. He should avoid certain foods and be sure to chew all food into small pieces. After all, a big unchewed piece of steak could pose a real problem. Anyone reading his medical record should be concerned about getting the scope done. The patient who had the knee pain is interesting because the story supports the medical necessity for the injection at the last visit. If the patient is seeing the doctor for chronic care of hypertension and he offers this story about the injection and resolution of his knee pain, then the story about the knee could be seen as mute. After all, the pain resolved. The story, however, tells of the success of the injection. Imagine if future injections do not help. Then a future status would show a departure from successful treatment. Such documentation would help justify perhaps a scan of the knee. The case of the patient receiving osteopathic manipulative treatment, OMT, tells of a problem that is improving but not resolved. Is more OMT indicated? Will the patient need to reconsider taking an anti-inflammatory medication for a short duration of time? The pain started after falling asleep in a chair and is provoked by turning the head to the left. We would want to know if the pain worsens or changes. If the neck pain persists, will this person need therapy or an imaging study? The purpose of medical documentation is to retell the story so that any professional who reads the record can tell what is going on. When looking at a series of medical encounters over time within a record, a storyline is told. Is a chronic condition being properly managed and maintained? Is, however, a problem getting out of control? Your status of chronic condition will help you tell this story and will help necessitate appropriate care. Sir William Osler, considered the father of modern medicine, wrote, "It is much more important to know what sort of patient has a disease than what sort of disease the patient has." In today's modern world of medical care, we have achieved great advances in the treatment of disease. We need to know about the disease. I do not consider Dr. Osler's quotation to be a departure from modern care, but to be a reminder that the patient and the patient's narrative is valuable health information. The story you write in your status will vary depending on your condition. I encourage you to work with your medical provider to cultivate what you write in your status. Ask your doctor, is this what you want to know? And are there any other areas you want me to report? Remember, you are the one who experiences the chronic disease. Let your assessment of your chronic disease be known in your status of chronic condition. Let me know how this works for you. Thank you for watching this episode of the Patient Advocacy Show. To your health, I'm Dr. Michael Warner.